Good afternoon, everyone. Thank you for joining us. We will just wait a few minutes while everybody starts to join the webinar, and then I will go over a few housekeeping items. Okay, we'll get started. Good afternoon, everyone. Thank you for joining us for today's webinar. Before we begin, I'll pause and we'll wait for a few more people to join us. I can see the numbers are slowly creeping up at the moment. During the webinar, you'll be able to add questions for our guest speakers via the little drop-down box in your control panel that says questions. Please post questions at any time and we'll allow time for discussion at the end, answering questions towards the end of the webinar. Your mics and camera will remain off for the session. This webinar is being recorded and will be made available probably about a week after the event. I'd now like to introduce Kieran Sampson from Eracy. She's from the Eracy Knowledge and Translation team to open this webinar.
Hello everyone. I'd like to begin this event by acknowledging the traditional custodians of the land on which I am, the Ngunnawal and the Ngambri people. I pay my respects to elders past, present and emerging. And I also welcome any Aboriginal and Torres Strait Islander people who are participating in today's webinar. Eracy hosts webinars to share information and promote discussion across a range of topics. We welcome the opportunity to highlight the research of others and centre the voices of those with lived experience. Through these webinars, we seek to grow capability and knowledge across the children and youth sector. Today's webinar came about in part due to Eracy's involvement with the National Early Language and Literacy Coalition. This group has been working together since 2016 to raise awareness about the importance of the neurodevelopment that occurs during the early years and its impact on language and later literacy development for Australian children. If you'd like to know more, please have a look at the website. A link will be in the chat, where you'll find a list of members and a comprehensive draft national strategy. Speech Pathology Australia are also a member of the coalition and have worked with us to support the webinar today, so our thanks goes to them. And thank you for joining us today as we examine this important topic. Most Australian children will experience at least one episode of otitis media, or middle ear infection, in their early years of life, with rates being significantly higher in some populations, such as indigenous children living in remote and regional areas and children living in communities facing disadvantage. Failure to detect and treat early ear disease leads to chronic otitis media. This often overlooked condition is associated with long-term disabling hearing loss, which can have a negative impact on communication, learning, behaviour, school attendance, education outcomes, employment, and can even be associated with incarceration later in life. We're pleased to be joined by Dr. Kate Armstrong and Laura Button to share their expertise and experience in what otitis media is, what to look out for, and where to go for help and treatment, and the impact that otitis media and its related transient hearing loss can have on children's language and literacy development. First up, we have Dr. Kate Armstrong, who is a medical advisor with NACCHO, the National Aboriginal Community Controlled Health Organisation. Kate has a background in clinical and public health medicine with a special interest in child health and the importance of an inclusive, rights-based community development life course approach to the prevention and management of non-communicable diseases, NCDs, in resource-poor settings. Kate's PhD through Flinders University focused on a health needs assessment to better understand the challenges and burdens facing children and families living with nephrotic syndrome in Vietnam. Welcome, Kate.
Thank you very much, Kieran, for that introduction. It's a real pleasure to be part of this talk today, and I'd especially like to thank Liz, who is behind the scenes controlling the slides for me. So thank you very much. Next slide, thanks, Liz. I'd like to start also by acknowledging country. I have the privilege, as Kieran mentioned, of working for NACCHO, the National Aboriginal Community Controlled Health Organisation. And I'd like to acknowledge the many ACCHOs. We have 146 member services around Australia that lead community-controlled, comprehensive primary health care delivery right across the country. I'm dialing in today from the lands of the Wallumattagal people of the Eora Nation, one of the 29 clans here in Sydney, and I'd like to pay my respects to elders past and present and to Aboriginal and Torres Strait Islander people on the line with us today. An overview of the talk today, just going to start with a little bit of a medical touched to it, I guess. I, in a previous life, used to work as a general practitioner. I'm now a public health physician working with NACCHO. But I just want to touch on otitis media. You know, what is it? What causes it? How does it present? But then really get into why is it such an important topic? What can we do about it? And then how can we support a child that might have otitis media? And I'll leave you with some key messages at the end there and links to other resources. So this is the ear, obviously, and I don't think that I have control of my of the arrow on this, but you can see that there's the different zones, the outer ear, the middle ear, and the inner ear. And the important point is that when you go to see the doctor and the doctor's looking inside your ear, they're looking down that canal there and they're looking at the eardrum. It's in the middle there, in the middle ear. And when we're talking about otitis media, we're talking about infections in that middle ear part. So the drum might be red, but often too there's fluid behind the drum. Those yellow structures behind the eardrum there and in the inner ear, that's where all the really complicated part about hearing happens. And they're the most intricate, fine instruments inside the ear. And there's very fine movement and vibrations of air that really allow us all to hear. Otitis media is when you get infections in there and you might get a buildup of fluid in there, and that really impacts on the ability of those instruments there to conduct sound and to help us to hear. That brown line that goes down into the inner ear there, that's the eustachian tube, and that joins our ear through the back of our throat. And so if a child has a sore throat or a respiratory tract infection, it can actually be quite easy for bugs and germs to get up through the eustachian tube and into the middle ear and cause an ear infection. So the next slide shows us what the GP sees when they're looking down through the hole in the ear, and that's a picture of an eardrum, not a very healthy one. I should have had a nice pink pale one to show you for a healthy drum, but this is a drum that's bulging. There's a lot of fluid behind it. It's red, it's angry, it's sore. And this is a classic sort of thing that you would look at for an otitis media. So the fluid is building up behind the drum. It's stopping the ear from hearing very well. So a child with that sort of an eardrum might present with pain, fever, and maybe not be able to hear quite as well out of that ear. So the next slide then is about how it presents, and I just want to acknowledge that it's a bit of a spectrum. So that slide that I showed you up the top is really just otitis media. It's that cute, you know, and you hear it, a child wakes up and they're crying, they've got a sore ear, you go see the GP starts you on antibiotics, otitis media. But it can progress. You could have a buildup of the fluid so much that there's a perforation in the drum. You could have chronic, recurrent episodes of ear infections. A child may only have one, or they may have multiple infections, or a child can also just present with chronic suppurative otitis media, where they just have some fluid coming out of the ear and they haven't had any pain at all. Or they might have long-term glue ear, effusion, fluid behind the ear and no pain, which is really just to say otitis media can present in many different ways. There's no one story, there's no one presentation, but they all have an impact on a child's health and well-being. So the next slide, thanks. Now, this sort of is getting into, in some cases, I won't say the weird and the wonderful, but you know, what are some of the complications of otitis media? Yes, a child has a really painful ear, they go to the GP, they have some antibiotics, but if otitis media is left untreated, it can have some really more significant side effects. They're not common, but the infection might go into the bone. It might affect one of the nerves. It can even, the intracranial complications can even go into the brain. There's been a very tragic case of a gentleman passing away recently in jail from undiagnosed otitis media. It can be extremely serious, but that all makes hearing loss down the bottom seem like it's nothing, like it's the least of our worries, but actually it's a really serious complication of otitis media, and it's really where I want to focus the rest of the attention in my presentation today. So why is that? This graph up the top, it shows you the impacts on human brain development, and the numbers along the bottom, that's the age of a child. So when a child's born, even before a child's born, they're starting to hear things, they're starting to be affected by things, their environment, and you can see that green line is where a child starts to build those sensing pathways. They're hearing, they're seeing the world, that's impacting on their brain development. That blue line, that's where they're learning their language, and that orange line is where they're really sort of developing those higher cognitive functions. Overlaid on all of that is that big black line, and that's where otitis media is most common. So from the in Aboriginal and Torres Strait Islander children, a very large percentage of children can have otitis media before they're 6 months of age, but right up until before the age of 8, that's where you're getting lots and lots of otitis media ear infections. That's where it's more common for children, and we know that it can lead to hearing loss, and it's happening at a time, the golden windows of childhood and child development, where we really need children to be hearing. So some of the consequences of not hearing during childhood are really extreme. It impacts on your speech and language development. It impacts on your learning, your education. It impacts on how you connect with culture and knowledge and hearing stories. It impacts on how you interact with other people, other children, parents. Sometimes people can think that a child's misbehaving or not listening, being rude, and really they just can't hear. And as Kieran mentioned earlier, there's lifelong consequences for well-being, employment, income generation, and really children achieving their full potential in life. I just want to touch then on equity. The next slide, thanks Liz, and acknowledge that otitis media is very much linked to the social and cultural determinants of health. And what does that mean? If you're living in a really crowded home and there's lots of people are unwell, you don't have access to healthy food, fresh fruit and vegetables, you're exposed to cigarette smoke, or your family can't afford to get you to the GP, or even if you do get to the GP, you don't have private health insurance, and so it takes months, if not years, to go and see an ENT surgeon. All of these things can impact on your health and well-being, and it's particularly the case with otitis media. And Aboriginal and Torres Strait Islander people, and I'd like to acknowledge long histories of colonisation, discrimination, racism, decreased access to services, a lot of people in remote and rural areas without access to services. They experience a far greater burden of ear and hearing health issues. The fact that 43% of Aboriginal and Torres Strait Islander people have measured hearing loss, and that's up to 59% in remote areas, this is a very serious equity issue for Aboriginal and Torres Strait Islander people. 14% of children over the age of 7 years have long-term hearing problems, and hearing and ear health issues contribute a lot to hospitalisations and GP consultations. I mentioned also wait lists. This was just an example at December 2021. There were almost 3,500 children in the NT on wait lists. And in New South Wales, children can be waiting up to 5 years to see a specialist for hearing health issues, for ENT needs. So just on to the next one then. Thanks, Liz. Kieran mentioned earlier that the lived experience is so important, and this is a story from Eden, a young Aboriginal woman. She's now a mother, and this is her story, and she drew this beautiful artwork here. It's in an ear with a hearing aid, and I think she really wanted to tell the impact that hearing loss has had on her life, and I will read it to respect her story. Hearing can mean a lot of different things for different people in different stages of their lives. For my artwork, I used my 4-year-old son, Phoenix, as inspiration. Phoenix and I drew an ear with a hearing aid, and inside I incorporated things that are very important to Phoenix. We included books to represent the tales and fables we read every night before bed, music because we love to dance, a dog for the long talks and secrets only Phoenix and Pip, our dog, understands, as well as many other things, including ourselves, as this is our story. Throughout my life, I have experienced many difficulties with my hearing, which will impact me for the rest of my life. It has created challenges that I have had to learn to overcome, and I am grateful to have had all the help and support I have received. I think one of the things that stands out for me with this story is that real strengths-based approach. Yes, living with hearing health, but people can be supported to achieve their full potential and to really achieve as much as to their full potential, to their greatest extent, even with a hearing loss. So what can we do to prevent otitis media? And I'm just really going to look at big picture here things. We've talked about the inequities. So for Aboriginal and Torres Strait Islander people, talking about housing, access to care, culturally safe care, and really closing the gap, and would like to acknowledge the national agreement on closing the gap and new ways of working between the Australian governments and Aboriginal and Torres Strait Islander people, which is helping us achieve that. Public health messaging, breastfeeding, first 6 months of life is really great. High quality antenatal and early childhood care, and Aboriginal and community controlled health organisations, art shows are a great place for families to access that sort of care. Immunisation, we mentioned infections before, healthy food, lots of vitamins, keeping healthy, but health awareness and education can really help. And everyone has a role to play in helping to pick up otitis media and hearing loss as early as we can. And the evidence shows that parents, if they feel that there's a problem, they're very accurate with their assessments. So believing parents is important. But early childhood providers and teachers all have a really vital role to play. And I know myself with our son, our third son, when he went to preschool, we were used to sort of interpreting his really unusual speech, but it took someone else outside the home to say, well, have you noticed that your child's, needs to see a speech pathologist, and really needs a little bit of help and support. So it takes a village to raise a child. Smoking is great to avoid, and respiratory infections, they're part and parcel of early childhood, but things that we can do to reduce that. And if children are having infections, getting them to blow their nose and clear out the fluid from the ears can be really effective. This next little video I was hoping to show, it's on the next slide. There's a link there, and Liz is putting a link in the chat. I don't think, Liz, the sound is working, unfortunately. Is it still not working? But please do take a look at this video. It only goes for 2 minutes. The things that stood out for me in this video is it speaks to the broad spectrum of way children can present. Some can present with, you know, crying and clutching their ear, but some nothing. There's no pain. There's no, you wouldn't know. They might just not be listening. They seem not to be listening. As I said, there can be a wide different range of presentations. The other thing you'll see when you watch this video, and it's gorgeous, is just how much time and effort is involved from parents and carers to manage otitis media, to go to the clinic, have someone look in the ear, to have the medicines. It's not just a one-off dose. They need to be given over a period of time and then go back to the clinic. Parents need a lot of support to sort of to manage this the best way. So just in closing, some key messages that I hope that people can go away with today. Just ask that question, could it be otitis media? Could it be hearing loss? If you do have some suspicions, act early and act often. Those early years of childhood development are absolutely vital. Don't leave it for 6 months and see how it goes. You know, those 6 months are the golden, that's the golden window for child development. Have that yarn with parents or carers if you in a sensitive way, not in a judgmental way, because as we mentioned before, there may be absolutely no symptoms at all. So having a talk, if parents think there's a problem, as I mentioned, believe them, because they're probably right, and support them to get access to the testing. And Laura's going to talk a lot more about all that aspect of it as well. If families are having trouble accessing ENT specialists or specialist services, let them know. Do what you can to support them. And for Aboriginal and Torres Strait Islander people, linking in with Aboriginal health workers or liaison officers can really help with addressing barriers and challenges. So thank you. There are some resources there on the Care for Kids Ears website, some colouring in books, posters, lots of materials there for teachers and early childhood centres and workers, and really recommend those, and we can put a link to that in the chat as well. So thank you, Kieran. Back to you.
Thanks so much, Kate. That was really great. I think it's really important to understand what's actually going on, which just helps you understand just the gravity of the problem. We've had a few questions during that session. What we might do is we'll wait till the end and we'll ask them after both presentations. But someone has asked about whether or not the slides will be available, and I think they will be, if you're happy with that. So I can answer that question now. Next up, we have Laura Button. Laura is a speech pathologist with almost 20 years experience working across hearing and education sectors. Laura is currently the project lead for the Listen to Learn program with Hearing Australia. In this role, Laura is working in collaboration with stakeholders to provide ear health and hearing education for staff in early childhood education and care settings and in primary schools. Laura actually has a sister with a permanent hearing loss and ongoing issues related to childhood otitis media, and along with parental experience navigating otitis media, as many of us have also. Welcome, Laura.
Hi, everybody. Thanks for having me today. I'm just going to take a minute to share my screen, just navigating the technology. And all going well. Hopefully you will see.
Yep, Laura, we've got it.
Oh, you've got it. Excellent. Fantastic. So I would also like to begin by acknowledging that I'm presenting from the lands of the Eastern Kulin Nation, where the Wurundjeri people are the traditional owners. I'd like to pay my respect to elders past, present and emerging, and extend my respect to all Aboriginal and Torres Strait Islander people here today and people watching the recording. I also want to note that I am presenting from my own perspective as a speech pathologist, a mother, sister, and for any information that I share today, please use it in choosing the best resources that match the community that you're working with to provide culturally appropriate and responsive ways of working. So when we talk about hearing, why is hearing important? And here are some word maps from audiologists when I've chatted to them about, when we're going out, we're working, we're seeing people, why is it important? What is it about? And we're always talking about it's that we want children to learn, to develop, to be able to communicate, have speech, to build relationships. And it really goes on to thinking about communication and what is communication. And for all people, we want them to be able to express their feelings, share their stories, make choices, say when things are working, not working, make friends, have great relationships. We live in a very oral world where speaking and listening is very important. We have great Auslan and as a communication as well in Australia, but where speaking and listening is important, hearing is a really key aspect of that. And in the case of otitis media, there's significant times where hearing can be affected. So I want to start with taking a bit of a sidestep away from otitis media and talking about permanent hearing loss. And the reason that I want to talk about permanent hearing loss is because we've got really great systems in Australia where we've got newborn hearing screening, and the image on the right here is from the Royal Children's Hospital as part of their newborn hearing screening program. And through that program, most children receive hearing screening at or soon after birth, followed by that, if there's a concern, they'll go to diagnostic audiology, and then they'll be referred to Hearing Australia, who has the responsibility for managing devices from that point, and then they'll be referred for a cochlear implant if needed. There's pathways for early intervention and there's funding options that are available pending that criteria. And looking at Australia, we have over 26,000 people up to age 25 who have hearing aids and or cochlear implants. And we know from some of the research that the Lockie study's done with the Hearing Australia research branch that that children have better spoken language outcomes if they receive their cochlear implants or hearing aids early. And the reason that I want to touch on this is because for lots of families that you might be working with and you ask them about hearing, they might say, my child's hearing was checked at birth, there are no concerns. And what we're talking about here is the otitis media related hearing loss that can fluctuate, it can be there at any point in time. And so it's quite a different conversation that we're having. So it's amazing to outrule that hearing loss was present at birth, but we need to then change the conversation to being about hearing and access to language and communication moving forward. So what about otitis media and hearing? So it's a common condition and affects up to around 73% of children by the age of 12 months, which is quite young. And of Australian children aged 14 years and under, in each year experiencing otitis media, 15 will suffer permanent hearing loss and over 250,000 will experience temporary hearing loss. So it really shows that we've got quite a significant period of children's life where temporary hearing loss could be a factor in their access to communication. If we're looking at the long-term impacts, parents reported that parent reports of ear infections at 4 and 5 years of age predicted later hearing problems, and a population study in Norway found that ongoing or frequent otitis media was associated with hearing loss in adulthood. And this is where I just wanted to touch in on my sister who she's managing a cholesteatoma and she's required surgical intervention. So that's what Kate was saying before, when you've got frequent hearing otitis media and it can lead to complications. So she's actually had surgery where some of her middle ear bones have had to be removed, and her next stage, once that all heals up, she will need a hearing aid. And her experience as well, she lives in New Zealand in a fairly remote area and she has to travel about 2 to 3 hours to get that specialised care that she needs. So otitis media can have ongoing complications through to adulthood, and definitely additional factors when travel is involved and resources are more limited. So some environmental factors that I'm just noting a few here because there's some that are a little bit more changeable. So childcare attendance and the number of children in each centre, and we can change things through there about thinking about hygiene and sanitisation and controls. Passive cigarette smoking and the use of a dummy after age 11 months are all following factors that increase the risk of otitis media. And as Kate said before, breastfeeding has a protective effect against otitis media. So when we're thinking about the impact of speech language literacy, because otitis media, hearing loss can be fluctuating, it can be short, it can be long, you never know exactly what a child's journey will be with their otitis media and the impact it will have. There are some factors that increase the risk of speech and language and literacy challenges. So early onset, more than one episode, long periods of infection, poor or no access to medical management, compromised environment, pre-existing condition, disrupted attachment, and the degree of hearing loss. So when you're looking at a child that you're working with, we can see that it's critical to get early intervention and change that child's trajectory by managing ear health as early as possible. So I'm going to jump into some resources now, and this is where I do just want to reiterate that there's a lot more resources than what I'm going to point out in the web, the internet, and seek out what is most relevant to you and your community. So the first part I want to talk about is communicating with families. And developing relationships with families, if you embed ear health and hearing care into everyday life, helps have those conversations on a daily basis or regular basis. And then when you need to talk about action, you've got those relationships in place already. Australia has many, many different languages. Many children have different languages that they speak at home, and parents have different languages as well. And so developing relationships in languages with interpreters where you need to, so that families feel comfortable talking about health and their access to health. If you can connect with your local community, your local medical services, to know what pathways are out there, so that can really help have these conversations with families so that you can talk about next steps and then support the families with taking them if they need to. And also mapping out the local pathways so you know exactly what supports you have in the area, what's available. It's really important that families are empowered to make their own decisions. So having these conversations regularly and early means that you're ready to go with the next steps. So there's lots of resources available to support early childhood and care settings with embedding ear health and hearing in everyday learning. As Kate said, that's the Care for Kids Ears resources. Our program Listen to Learn is funded by the government, so it's free to access, and we have open sessions and self-paced learning in relation to ear health and hearing and preventative strategies for in the early childhood space, and also the same again for in the school space. And Deadly Kids Can Listen and Learn. There's a lot more resources there for training and staff development. Regular ear checks are really important. My doctor, I basically walk into the room now and he says, you know, the ears are going to be fine, because every time we go, I want him to check in my child's ears and make sure that they're still okay. We had the experience when my little one, who's almost 2, when he started childcare, the first 6 months were otitis media, really high temperatures, antibiotics, and a referral to an ENT. We were lucky to see one, but not quite when the otitis media was at its peak. So very happily things had resolved when we went in, but it's something that I really want to keep a close eye on. And so we will continue to, every time we go to the doctor for any reason, just check in his ears and make sure that there's not some otitis media present or impact fluid behind the ears that might not have any symptoms that are obvious at the point in time. For Aboriginal and Torres Strait Islander children who are aged 0 to 6 haven't started school yet, Hearing Australia has the hearing assessment program early years. And that our team of audiologists and clinical community officers work out mostly out of Aboriginal medical centres and community controlled clinics and provide ear health and hearing services. So if you have children who you want to refer to this service, then reach out to Hearing Australia and we can direct you to where the nearest clinic is. It's really important to take all opportunities to promote communication so that when the child is hearing well, they're getting lots and lots and lots of language and literacy and modelling. Racy is doing a lot of work in the literacy space, and the blog about literacy begins at birth is a really important thing to think about. When I brought my little one home and he was just a couple of days old, and I passed him to my mum and passed her a book and said, read him a story. And she sort of looked at me and said, what am I going to do with this? I just said, read him a story, because, you know, you don't know what language a child is going to take on board at that point in time, but every little bit is leading towards building language skills. There are a lot of resources. The Indigenous Literacy Foundation is building a lot of text in language, and so where you are, have a search around and see if you can find tools and resources that really support your community. This page here by letsread.com.au just shows you that literacy doesn't have to be about holding a book and reading. A lot of families aren't confident with reading, aren't confident with reading in English, or might not have access to the books that are in their home language. And so reading can be about looking at a book, it can be about telling stories, it can be looking at the pictures, it can be talking about what you're doing. It's really about building vocabulary for that child and their exposure to different words in different situations. And it can be something really simple when you're talking about modelling language and telling stories. The other day I changed the bed sheets and had my little one with me, and I said, we're going to the washing machine, and he said washing machine, and I said washing machine, and he said washing machine. And by the time we'd taken just a couple of steps to get to the laundry, he'd you know, had that modelling of washing machine, said multiple times, had the opportunity to say it. So it wasn't an exciting you know, story. I didn't have to be super creative. It was just talking about what we were doing, and that's another great way to promote opportunities for language and language development. Lots of library programs have got you know, singing, songs, nursery rhymes. There's lots of parent groups, all sorts of things that promote language and communication and singing and turn taking. And all of these provide children with a really rich language environment. And so, you know, we're capturing those opportunities in between otitis media and fluid when the child is hearing well. And the more we do these sorts of things as well, we can see when a child is behaving differently. If we keep a close eye on them, maybe they were interacting one week and then they were sick and now they're not as much. And maybe, you know, that's a sign that it's worth investigating further to just see if there's a bit more going on in the ears. There's this resource from Hearing Australia that's talking about yarning at home. There's interactive activities on apps. So this Bright Tomorrows is an app where it gives lots of opportunities in everyday life, and the same with Vroom. Just how you can expand language based on what you're doing every day. And these are really good strategies for in care or in home, just for promoting language and language development. We can monitor communication in a more formal way. So there's some assessment tools. The Plum and HATS is a functional listening and milestone checklist that can look at how a child is listening in quiet versus noise, and whether they're looking like there's some challenges with hearing or with milestone development, and to make recommendations to go further. Functional listening index is another functional assessment that's used often in hearing intervention programs, and again measures listening in different contexts. The ages and stages, this is becoming more formal, so these ones are a lot more of an investment and training, but they measure developmental milestones. The ASQ3 and the ASQ track are two different versions with the ASQ track being one that has been adapted to be more culturally appropriate for Aboriginal and Torres Strait Islander children. That one's significantly more expensive. The other two are free, but depending on what your service wants to do and the steps that you want to take. Otherwise, you might see an ages and stages questionnaire that comes via your service. And if you're asked to fill one out, you'll know what that one's from. And you can use communication milestones. So at each age, there's a list of things that a child who's communicating well will be able to do. They'll be able to understand a certain amount. They'll be able to say a certain amount. They'll have a certain level of intelligibility. And so following communication milestones can also be a measure for monitoring children and checking that they're on track in that space. So in summary from my end, permanent hearing loss is most often diagnosed soon after birth in children who have earlier fitting or with hearing aids or cochlear implants achieve better spoken language outcomes. Frequency, length and severity of otitis media is associated with poorer speech, language and educational outcomes. But there's a lot that we can do to help reduce the impact of otitis media. If we engage with families, work with families and communities, encourage regular health checks, promote language and literacy development opportunities, and monitor communication development, there are so many different ways that we can catch kids early and either through prevention or early intervention make a big difference on their lives. That's all. Oh no, I do have one more slide. So could it be? There is. It could be, but prevention and early intervention is definitely the key.
Thanks so much, Laura. There's lots of great resources there and links to the resources. Now I'll take the opportunity to have some questions if anyone has them. We have a question from Jane in the chat, and she said, I've researched widely to find nose-blowing visual and video resources for families using the block 1 nostril blow, clear and repeat nostril method. And she's asking for some guidance. There's varying levels of literacy and language in the families that she works with, and what would you recommend for practical help like that?
I'm not sure if Kate's still there, but I just I couldn't quite hear you. I've moved my laptop a little bit closer. My audio is not working very well. Would you mind repeating that for me? Oh, there, Kate.
Sure. We had a question from Jane in the chat, and she said she'd researched widely to find nose blowing visual and video resources for families using the block 1 nostril and repeat for the other nostril method. And she said she just appreciates some guidance around that kind of practical support, and that they have varying levels of literacy and language in the families that she works with.
Did you want to? I'll jump in.
Oh yeah, I'm happy to have a go. The video that I shared speaks a little bit about nose blowing, and there are some visuals showing children blowing up balloons with one nostril and so forth. With regards to a specific resource place where to go for that, I don't know one off the top of my head, but I can look into it afterwards and send it through to you if you like, Kieran. But I don't know, Laura, if you know of other resources off the top of your head.
There's a nice little video called Breathe, Blow, Cough, and it talks about, so it really guides you through taking some deep breaths, blowing your nose, coughing, and doing those sorts of things to try and clear the pathways. And also, you know, while you're doing those sorts of things like eating crunchy healthy food can also be an activity that can support. But yeah, if you have a look for Breathe, Blow, Cough, that's a nice video that you could share with families. It's very step by step.
If anyone has any questions, please pop in the question box. Jane says thank you. I have a question, just maybe sort of extending on that, in an early childhood and care setting. What are some of the other sort of things that can be built into the day to try and help and mitigate the sort of risks I mean, I assume obviously hand washing, but is there anything specifically to help with hearing health?
There's definitely things like hygiene measures, washing hands, and general cleaning, but also having a look around your room and seeing, you know, are there noisy areas or quiet areas? And depending on what you're working on, if you've got somewhere that has, you know, more carpet on the floor or something that can just, if it's all hard floors and hard tables, that can increase the background noise a little bit through reverberation. So just thinking about what you're doing and making sure that you know that any child at any point in time could have hearing loss related with otitis media, making sure that they can see you and hear you, and that if you're doing an activity that's language related, reading a story, modelling language, that they have really good access to being able to hear what you say. And that sort of, you know, physical movement around the classroom, the room can make a really big difference.
And I think, Kieran, the only other thing I'd add to that is sitting in with an ENT surgeon while he sees child after child after child with otitis media, just the importance of nose blowing. You know, getting children to get into the habit of blowing their nose every meal, you know, wash their hand and then wash their hands and have the meal, so it becomes a bit of a habit. But just really clearing the fluid from inside the ear down the throat, and as a child gets older, they can hear that pop. They can learn to pop their ears to clear the fluid out of their ears as well. But nose blowing, it's just such a simple thing, and you know, you can build it into a you know, come and have something to eat, blow your nose, wash your hands, and it's just a message that you hear emphasised a lot more than you might have expected.
For very young children, I've seen that little sort of suction siphon things. Do you recommend those for clearing quite young children's nose, babies' noses?
I don't actually know the evidence on that. Laura might know better. I don't know the answer to that, sorry. Yes, and it's been probably 10, 15 years since I worked as a GP now, so the things I might have said, I'd probably have to check the evidence base on. But yes, don't have any advice on that, sorry.
We have another question from Ariel. She asks, do you have any screeners for high school students that we could use as an assessment towards investigating reading difficulties?
Investigating reading?
Yeah, so they've noticed, you know, if there's a connection between their hearing and reading difficulties, is there some sort of suitable screener for that age group?
I think once you're getting to high school students, I'd probably connect with, if you can, a local speechy in the area. There are a number of standardised assessments to measuring literacy, and there's lots out there. But sometimes, just if they're new and different, having a speechy who can help guide through the use of those is really helpful. There is a screening tool for hearing called Sound Scouts. I don't think it quite goes up to that age, but it does measure hearing, in, you know, whether it's likely to be conductive hearing or whether it's likely to be sensory neural hearing loss. So so that's a tool that's accessible by schools that they can use to do a quick check on children's hearing. So there's probably connecting with your local network is the best. Ask if you have a speechy nearby, and that will help give some more information about whether there's tools already available, or whether there's some more options about what would be the best fit for the area that you're in.
Is that an app? Sound Scouts?
Yeah, Sound Scouts is an app. Yep. So you can, if you Google Sound Scouts, it's an app that you can download on an iPad, and it's a game basically. So the child or person doing it listens to something and then has to press a button in response in a game sort of way, and then it's a pretty good indicator of whether they pass hearing, whether it might be conductive, it might be sensory neural.
We've had a couple of comments in the chat section, and Mary Ruth Mandel is on the line from the Australian Literacy and Numeracy Foundation, and she notes that Sound Scouts is currently free, and Jessica said you better rush on down because it's only free till the end of June. So
Yes, we're not sure
yes.
what that is true. We're not sure what's happening after June, but yes, currently free. So yes, it's a great one to download in the next 4 weeks, and measure hearing while it's free, and then after June we'll know what's next for that one. Thank you.
Great. If anyone else has got any questions, quickly pop them in. I suppose I had one more question, maybe it's for you, Kate, is that the old question around antibiotics, and that we, it seems for some children they're the first point of call, but other doctors will hold off. Is there any sort of guidelines around that?
Yeah, look, I think that, well, I won't get into a clinical discussion on that, but yeah, certainly for otitis media, you know, antibiotics are important. Obviously, you know, we don't want children to be taking lots of antibiotics over a long period of time unnecessarily, but judicious use of them, you know, is an integral part of the management. There's also other treatments, so ENT surgeons, grommets, which is a little tube that can go into the eardrum to allow the fluid to drain out, can be really an important part of treatment as well. So I guess I'd be leaving that to the GP to make a decision based on what they're seeing down the ear canal. But yeah, antibiotics do have a role to play in the management of otitis media.
Sue was just saying, is that sounds gap? I think maybe she's referring to, was that something you talked about, Laura?
Oh, the app Sound Scouts, SCOUTS.
Sound Scouts, sorry, I see what she's saying. Well, does anyone else have any questions? Is there anything else you'd like to say, Laura and Kate?
Just how important hearing is for children. Your turn, Laura.
Yeah, absolutely that hearing's so important, and the tricky thing about fluctuating hearing loss with otitis media is you never quite know. I mean, sometimes there'll be obvious signs, but quite often there won't be, and so taking this first step to learn more about it, to start looking at the signs and the resources, and embedding ear health and hearing care into everyday practice are the really key steps into, like I said before, changing the trajectory of children with their speech and language development outcomes. So everything that anyone can do in this space can make a really big difference.
We do have a last minute question. Jessica would like to know about bone conduction devices for otitis media and what the eligibility is. Anyone know the answer to that?
I definitely don't want to say the wrong thing here. There are, Hearing Australia can provide bone conductors for children who have an ongoing conductive hearing loss. The exact criteria about that, I don't know. But we know, because there are such long wait lists for some children to get to an ENT, having a bone conductor can be something that fills that space in the middle. So the best thing to do is to monitor a child's hearing, their frequency of having ear infections, follow up with a hearing test, and then if there's an ongoing hearing loss that's diagnosed in connection with conductive hearing loss, there are options for bone conductors. But it is sort of following that process first, and having different points of hearing loss to show that it's something that's ongoing, and then that you want an interim plan before a child can get into an ENT. So the short answer is that, yeah, if you are worried, call Hearing Australia, and they'll be able to give you some more information on the guidelines on when we can provide bone conductors.
Thank you. And maybe a final question. It's actually something I was thinking about. So this relates to the literacy aspect. Oftentimes in school, teachers are wringing their hands around children in those first 2 years of school and getting them up to speed with reading and language. And I think often it's just something that wouldn't even be on the radar, that perhaps this could be a problem with their hearing. And Ariel's asked another question, why isn't testing happening in primary schools through the Department of Education? Now, I'm aware that certainly in the ACT that happens in kindergarten, but have you got anything else to say around that? Like you said, that there's fantastic national screening, a newborn screening for hearing, but is there any moves to bringing in sort of universal screening later in childhood to catch these sorts of things that are caused, you know, after birth?
There are so many different programs that provide ear health and hearing screening. Some primary schools do, some nursing programs do, some community programs do, some private audiologists do. So there is actually quite a lot out there in different places. So the first thing to do is to try and find out what is available in your local area. There isn't sort of a nationwide hearing screening program at different points, and I think some of the problems are around resourcing. So we know for permanent hearing loss that it really does make a significant difference for long-term outcomes if we diagnose permanent hearing loss early and fitting and diagnosis. So there's a lot of evidence to say that that time point makes a big difference for outcomes. Picking the next time point when we know that otitis media is fluctuating and it can come and go, it can be there at different times. So it's quite hard to know exactly when's the best time point for having another national screening program. So I think the best thing to do is to find out what's local and take rapid action, not waiting for, that might be a prep or, your first year of schooling, just as much as possible finding the services that are available before school.
I think we might have lost Kieran, unfortunately. So thank you very much to our presenters, Laura and Kate. We're going to wrap up the webinar right now. Thank you to our audience for joining us today. If you have Okay, I think we've lost Kieran. Apologies about that, everyone. Thank you to Laura and Kate for joining us today. Thank you for sharing your wonderful expertise. We've had some great comments come through that people have really enjoyed this session. Thank you very much. As we said, we will be sharing this information with you via email. We'll share a copy of the recording and it will be up on the ARACE webpage within a week. Thank you very much, everyone, for joining us. If you haven't already, please sign up to the ARACE e-bulletin. I've just popped the link in the chat. This is how you will find out about these sorts of webinars and when the recording is available. So thanks for joining us and have a wonderful afternoon.